So my name is Zoe Clark. I'm Senior Self-Management Programme Officer here at NASS. And today I'm delighted to be joined by Ruth Larkin, who's joined us a few times before. Hi Ruth, how are you?
Hi, I'm good.
Brilliant. So Ruth is a sports massage therapist and a Pilates instructor as well. So we're really looking forward to this session. You may have seen her previous sessions when she did some Pilates focused on a morning routine to help you loosen up and get started for your day, and some seated exercises as well. Do you want to tell us a little bit about yourself and what you'll be doing for this session, Ruth?
Yeah, sure. So you may see that I've got quite a few things around me, but don't be alarmed. It's just so I can give you sort of various options. I've actually recently moved to Hong Kong, so hence it's a bit dark here, so I'm on a slightly different time scale. And it's really given me sort of a bit of a new insight, because I'm now working with a whole bunch of new people who I don't know. And one of the things that I've noticed is how some people don't really sort of understand how to adapt their practice for themselves. Because regardless of whether you've got any sort of long-term condition, and I have AS myself, so I'm sort of in this boat with all of you guys too. But whether or not you have that, or whether or not you have any other condition, or, you know, sort of maybe you're in a postnatal stage, or whether, you know, you've had an injury, there's not really going to be a session, unless you have a one-to-one just for you, that's going to be entirely perfect around your body and your needs. So it's really important, just right on cue, that we have things around us that we might need. So what I've got is my trusty resistance band, which is really, really useful for building up a little bit of strength. And I really like using that because you can use it for stretching and for strengthening, and it doesn't have to be sort of anything crazy. You can do certain things sitting in a chair, which we'll have a look at today as well. And then I've always got a cushion with me. Because one of the other things that happened this year for me is I had to have a little surgery on my neck. Hilariously, the surgeon that I saw explained to me kindly that it wasn't my AS, it was my age. So I had a bit of a pinched nerve, and so they just sorted that out for me. But when anything sort of like that happens as well, you know, when I was rehabbing and starting to teach again after that, I really did need a bit of extra support under my head. So I've always got a cushion with me just in case. Some days you might need it, some days you might not. And then of course I've got a blanket as well, which will be useful for a couple of things that we're doing in this session today. Because I think, as I said in one of my previous sessions, a lot of the adaptations for exercise for anybody really is not kind of rocket science. If it hurts, stick a blanket under it. A lot of the time that's a really good sort of way to get through. So yeah, just remember that, you know, just make things fit your body and your needs, and then, you know, the rest of it can sort of, you know, see how you are from day to day. As we know, all of this condition can be really, really unpredictable. I'm kind of at the end of a sort of week-long flare myself, so yeah, it's kind of one of the things that I've been thinking about, is how to keep things ticking over.
That's fantastic, thank you. I can tell already it's going to be really helpful for so many people watching as well. And I'm glad you've got a live demo there. You've got a body to demonstrate.
Yeah, now that I'm not in my old house, I don't really have sort of anywhere to put. Like to be involved in my broadcasts, so I will yeah, try to just get him, you know.
No problem at all.
I know, there we go. Marvelous.
Brilliant. So for everyone watching, if you're not able to join in live, then don't worry, because the video will stay on our Facebook page after we've got finished the live stream, and we'll also pop it on our YouTube page and our website as well, so you'll be able to come back anytime and repeat the session. And do pop any questions for Ruth in the comments. I'll keep an eye on those as they come in through the session, and we'll have some time at the end for a Q&A if you have any Pilates related questions. So I think that's everything. Are you happy for me to hand over to you, Ruth, and then we'll catch up at the end?
Yeah, absolutely. Let's get started.
Wonderful. Thank you.
Great stuff. So lovely. So thanks for joining me, everybody. And again, like, don't be alarmed if you have sort of never done Pilates before. Sometimes people can be a little bit put off or have an idea of what it is. But really, it's kind of just some pretty basic sort of mobilization exercises to just balance up our strength and our mobility, which of course for anybody with any sort of joint condition is really, really important. So as I said, I'm just on my mat here on the floor, but there's quite a few things that we're going to do today that actually you could do lying on your bed. So don't worry if getting down to the floor isn't really possible every day for you. But also, we don't really want to keep adding to our list of never to do ever again things. So, of course, some days it might be preferable to change your practice so you're maybe starting on your bed rather than on the floor, or maybe being on a chair or using a chair for some things is preferable for you. And as I said, I had a little surgery on my neck earlier on this year, and it really reminded me that actually, again, lots of us have issues in different places, don't we? Like for me, my fusion is sort of really around the sacroiliac joints now, and that's really been the source of a lot of my problems. So personally, I prefer to do everything lying down, because even seated and standing up puts a lot of pressure through my sacroiliac joints, and I don't enjoy that as much as the relief I get from lying down. But some of us will have their problems more maybe in the center of your spine. Some of you might have the problems in your neck. And I know a friend of mine, all of her issues started around her shoulder. So it's not going to be the same even for those of us, you know, with this similar condition. We all present quite differently. But with all of that said, I am going to start lying down just so we can have a little think about our abdominals, because obviously those want to be really strong. And so, sir, if you could just maybe get out of the entire line of the camera. So I'm going to use my cushion behind me. Sorry. There we go. So if you need a blanket underneath the lower part of your hips, that's absolutely fine. I used to have a much thicker mat. This one isn't quite as thick. So sometimes if I'm a little bit sore in the back there, I will sort of put a blanket under. And of course, you might need a little bit of cushioning under your head. You might not need it, but we want your head to feel comfortable. So whether you're lying on the floor or whether you're lying on your bed or sort of in any other position, just make sure that everything feels comfortable as it can be before we start. So I've got my knees bent and my feet on the floor. I'm trying to have my feet level and my legs in parallel, just so then I can relax the shoulders and I can relax my chest and I can relax my head and start to think about the position of my pelvis. So I know we've done sort of lots of pelvic movements in the other sessions that I've done that you might want to go back to. But when we're thinking about our pelvic position, it's kind of a lot of the abdominal work that puts our pelvis where we want it to be. But a lot of the time we think about our abs, we just think about the front, kind of that six-pack sort of area. But we want to think also about those deeper abdominals. So everything sort of a little bit deeper into your tummy. And we talk about this a lot in Pilates because it really helps with our stability. So to sort of find what we're thinking about, what you can do is just place your fingers onto your hip bones at the front. So finding those sort of bony bits that stick out the front, and then just let the fingers sink in just a little bit and push down, and then just cough. And you'll feel those muscles kind of pop up against your fingers. So they're a lot sort of deeper down and a lot further down your body than you might think. So if we focus on this area rather than just sort of the upper stomach muscles, it can give us a little bit more body awareness and how to move without, you know, sort of straining through the joints. So thinking about these muscles, let's just see if we can give them a little bit of a squeeze as we tilt the pelvis up towards you. and then relax everything as you tilt away. So just starting with these gentle pelvic tilts. It's always a nice way to start, I think, because it gives you an opportunity to notice how your lower back is feeling. Sometimes we might just have this idea in our heads that, you know, it's a lower back issue. Is that true today? Are you in your sort of normal state of affairs, or is anything a little bit worse or maybe better than you might expect sometimes? So I'm just doing a few little pelvic rocks here, forwards and back. And then I'm going to find the middle point of that movement where my hip bones feel nice and level. And then again, I'm just going to make sure that as I've moved through the pelvis a little bit, is the rest of my spine still comfortable? My shoulders still relaxed? Is my head still relaxed? And can I take a nice big deep breath in and then relax more as you breathe out? And as I've said before, we match our movements with our breathing in Pilates to make sure that even though when we're working hard, things are still relaxing through our nervous system. So we can actually do abdominal strengthening exercises without moving our body at all. So if you're in a stage where you don't really feel like doing an awful lot of movement, you can actually just strengthen the tummy muscles in any position. So you could do this sitting, you could do this standing. Thinking about those deep abdominals that we've just found, all we're going to do is try to squeeze them quite hard. So we're going to take a big inhale and then exhale, pull your belly button down, tighten your tummy muscles and try and pull the abdominal muscles in all the way around your waist if you're tightening a belt around you as hard as you can. So just squeeze everything in, squeeze, squeeze, squeeze. And then when you can't squeeze anymore, we're going to hold it for 5, 4, 3, 2, 1, and then relax. So it's quite hard work to engage all of those muscles and think about everything around your waist. Let's do that again. We're going to breathe in. And then as you breathe out, pull your tummy down, flatten everything in, suck in around your waist as if you've got that tightening of a big belt around you. Hold it there for 5, 4, 3, 2, 1, and relax. And I usually do this 3 or 4 times. So let's have one more go. Breathing in, breathing out, squeeze the tummy in, pull that belly button down, feel like you're tightening everything inside the pelvis and your waist gets firmer, and then hold it there for 5, 4, 3, 2, 1, and relax. Good. So now we've found our sort of awareness of all of those deep tummy muscles. We don't generally need to squeeze that hard for doing anything that we're going to do on the mat. We kind of want to just use as much pressure for the job that we need. But now we've sort of found that, let's see if we can get a little. So we've done some pelvic tilting forwards and back, just like this. And in one of the other sessions, we also did the side to side, that sort of east to west tilting. But what I really like to do is put those movements together so we do a circle of the pelvis. So imagine you've got a plate on your tummy and you've got to make that plate sort of spin like a spinning top. So nice and slowly, I'm going to tilt my pelvis forwards. Then it's going to go over to one side. Then it's going to roll back. Then it's going to go over to the other side. And then it's going to go forwards. So my bottom doesn't leave the floor. I'm just rolling the pelvis round. The other way to think about it is like, imagine you have a clock on your tummy and you've got to roll around each number of that clock. So you get this nice little circular mobilization through the back of the pelvis, through that lower part of the back. And then we're going to try to go the other way. And sometimes your brain doesn't like to go the other way. Feels like a little bit strange. If you're not getting this movement straight away, don't worry, because it does feel quite unnatural. It takes a little bit of practice. But when you get it, you might feel a nice little release in the lower part of the spine. Very good. And then coming back. Lovely. So now that we've loosened off sort of through the lower part of the spine, got some mobility through the pelvis, what about the midsection? So the way that I really like to move the spine is piece by piece and bone by bone in a sequence. So like a sort of caterpillar movement, because I feel that like really gets me moving more than anything else. So we're going to go into a little bridging, and I'm going to give you a few versions of this. So don't worry if it feels a bit fancy, but actually it's really good for strengthening your glutes and your hips and everything through your legs as well. So we're going to start with the normal version, just on the mat. So we're going to breathe in again. As you breathe out, you're going to take your pelvic tilt towards you, pull your tummy down and squeeze. And then you're just going to keep going, and you're going to lift your spine up off the floor. Now you might just get a little way off the floor, and that's absolutely fine. And then you come down again. But remember to ripple the spine back down so you don't come down in one kind of straight clump. Let's go again. And of course, with padding any way you need it. And then you can just experiment with maybe lifting a bit higher. And if you lift higher, you'll feel that pressure sort of in the middle part of the back into the shoulders. And it might feel quite nice as you come down heavy through the chest to release. Good. Now we take this as far as you like, sort of coming up, even to make like a straight line from your knee down to your shoulder, and then releasing back down. But just see how that feels for you in your upper part of the back. The other way we could make this a little bit more accessible, I'm going to scooch forward just to show you, because you can just pop your feet up on the wall. And imagine if you were lying in your bed, you could be lying on your mattress with your feet on your headboard, maybe. So now sometimes if your sort of sacroiliac area is feeling a little bit sensitive, this might not feel comfortable. You might prefer that first version without the feet up. But if you're looking to get more mobilization through the upper part of the spine, this is quite a nice supportive way of doing it. So I'm going to take that bridge movement again, just keeping my feet pressed into the wall, and my hands are down by my side, so I've got some breaks here if I need them as well. So let's breathe in and try. Breathing out again, squeeze the tummy, pull that belly button down, tilt the pelvis, and then just lift up. And you can feel that if you're pressing your feet into the wall, you've got more support. You might be able to actually lift up quite high. And then exhale, press the chest down, keep the tummy squeezing so we've got that support, and then we're coming all the way down, and it's a really nice release. I'll just show you one more time, coming up. Good. And then coming down. And we just keep it moving. I'm not going to hang around at the top of that position because I don't want to put excess pressure on my neck. I'm going to show you one more version of this because with my able assistant over here in the way as ever, you could do it with your feet up on a chair. So this would be a really good way of strengthening your hamstrings at the back here. So sometimes it's a bit of a challenge if you haven't got sort of very flexible hamstrings to do things like sort of squats and lunges. Sometimes that's quite difficult, but you can really strengthen them by doing this movement with your feet up on a chair like this. So of course with your feet on the wall helps, but this is even a slightly harder version. So I've got my heels pressing down. Make sure you've not got a chair that's on wheels, obviously. And I'm going to try from here. Now it takes quite a lot of squeeze from the tummy, quite a lot of squeeze on those glutes. And as you lift up, you'll feel the backs of your legs tighten. And you don't actually have to lift very high to get that tight sensation at the back of the legs. And then you can just come back down. So even though you're getting a good bit of strength work into your legs, it's still quite a small movement. Of course, you can build up into. So when you start to feel a bit more confident, or maybe you feel like you can already, you can just push into the heels a bit more and lift up a little bit more. And oh, crikey, that works the backs of the legs quite hard. Good. Now, what's quite common in this position is you might feel a little bit crampy kind of through the backs of the legs. So it's nice to have a little stretch from this position as well. You could quite happily keep your feet lifted up onto a chair, or you could put them back down onto the floor. So just for me, because it's my preference, it might not be your preference, I'm going to pop my feet back down onto the floor here. And I'm going to take a nice, simple little active hamstring stretch now, which is nice to do after we've given them some work. So I'm going to just catch behind one thigh. Now, of course, if like me, I've got very long arms, so I can easily reach behind my thigh. If that's not something that's accessible to you, then grab a band, a scarf, a strap, a belt, anything that you've got, and you can just hold your thigh this way. And all we're going to do is stretch the knee and bend the knee. So again, it's super simple, but it's an active stretch. And I prefer active stretching to just kind of stretching and holding it there, because for me, that kind of just feels like I'm pulling on my joints. But if I keep it active, i.e. it's moving, then I feel like I'm getting more out of the movement, more out of that position, more out of the stretch, and it doesn't kind of stress my joints as much. Now, of course, you might not be able to get your leg all the way straight. The reason I can is because I'm a bit hypermobile and I've got excess movement in my hamstring. So this is normal for me. But if you can't get the knee all the way straight, don't worry. That's just what we're aiming for. And of course, you might be holding your thigh. Now, as I'm doing this, I'm imagining that I'm pushing something up with my foot that's quite heavy. So I'm almost creating a little bit of resistance in my own body. And if you do that, you'll then feel a little bit of work in the front of the quad here. So I'm actually now strengthening my front thighs without putting any pressure on them. Good. Let's have a little go with the other side, just to even things up, trying to keep my shoulders still relaxed. And then the knee just straightens and bends. Actually, I can feel the difference in this side because it hasn't had a stretch yet. Good. Lovely. Just a few times pressing up, imagining that my foot's really heavy and I've got to push it up through the air. Good. So we're getting that nice stretch on the back of the leg, maybe a bit of action happening around the knee. And when we're happy that that feels a little bit freer, then we... Good. So what about working from the top down? So I'm just going to come up to sit, because as we're sort of working a little bit into more the middle of the back and the upper back today as well, there's a couple of things that I like to do in order to strengthen my core and mobilize my spine. So this could be done sitting on a chair, it could be done on the floor. And I've got a little trick, which I really like, in using a blanket behind me. So this is going to be just nice and comfortable. I'm going to stretch my legs out front. Now, if it's not possible for your legs to be sitting in this position, which for a lot of people, AS or not, this is not comfortable, feel free to bend the knees, of course, because that's your adaptation. What we're going to be doing is leaning back and rolling back, possibly all the way to the floor, possibly not, but I'm going to give you all the different options so you can just give it a try. So whether your legs are straight, if that's comfortable, or if the knees are bent, if that needs to happen for you, either which way, I've just got my little blanket just behind me. So kind of probably a couple of inches just behind my sitting bones. Then I'm just going to slouch and lean back. So I can feel the blanket into my lower back. And then I'm just going to inhale and come all the way back up. Now, if this is already feeling a little bit challenging, oh, look, I've got my thighs here, I can hold on. So there you go, there's your kind of little adaptation here. If it's feeling quite easy, then we're going to just hover the arms. So you choose how far back you go. The idea is that eventually our tummy muscles are strong enough for us to lie all the way down onto the floor. We take a nice big inhale and stretch. And then as we come back up, breathing out, you'll feel that that little blanket under there just helps lift you up. You don't have it there, it's really, really difficult to come up smoothly. The other way to practice this is tucking your toes underneath something heavy and just helping yourself back. Or maybe you have an able assistant at home who could just hold your ankles for you a little bit. But you'll feel as you come back up, that blanket just lifts you through maybe that stiff section. And then of course you could move it a bit further back. So say I was feeling quite stiff in the middle part of the back, I could come down over the top and get a really nice stretch here. Oh, breathing in and then breathing out. And if you're struggling to come up, grab hold of those thighs and help yourself up and through. And we sit nice and tall in between, and maybe it's even back a little bit further. So you choose, where does this need to be useful for you? Maybe you just kind of lean back onto it and it's not comfortable for you to put your head back. If that's the case, don't put your head all the way back. Just come all the way back up again. Very good. So one more time. Squeezing that tummy in. Remember, we found those deep core muscles that we're trying to use. Coming back, and then grab your thighs if you need, and come all the way back up. Lovely. So we're working all the way through the spine, but what about this upper part of the body? And of course, we need to be able to control our shoulders, but sometimes this is like a really common area to feel really stiff. Or that part of your spine kind of right in the middle of your shoulder blades, which often for most people will get a little bit stiff. So one of the ways that I like to deal with this is to just make sure that I know how to move my shoulders and where they should be sitting. Lots of us kind of, previously were told, shoulders back, we've got to sort of have this open chest. But actually, anatomically, our shoulders should just be sort of hanging and our arms naturally sit sort of just slightly in front of the midline of your body. So you should never be trying to kind of pull the shoulders back too much. But what I'm going to show you is a little bit of resistance as well through some shoulder strengthening work. But just, again, choose the option that you feel works for you. There's going to be loads of different options. So I'm just going to turn around. So forgive me for turning my back to you, but I just want you to see sort of how my shoulder blades are moving so you understand what we're talking about. So shoulder blade, it kind of just floats around on your back, and everybody's is quite different. So depending on how your body is made up, whether you're sort of more mobile or whether your collagen is a bit stiffer, the movement of the shoulder blade will be a bit different for everybody. So mine move around quite a lot more than average. So if it looks a bit weird, don't worry. So what I'm going to do is just hopefully you can see my shoulder blades at either side of my top here. I'm going to put my hands onto the wall. So I've got a little bit of resistance here. And then I'm just going to push. So my shoulder blades come apart. And then I'm going to squeeze them together. So I'm just pushing into the wall so the shoulder blades gap and then squeezing them together. And this is just isolating the movement of those shoulder blades. So hopefully you can see what I mean. It's helpful to have that resistance of the wall there so you can really understand sort of how they're moving. So I'm moving my shoulder blades without sort of any involvement of my neck, without any strain then. And I'm strengthening those muscles kind of right in the middle. I'm also trying not to hunch through my shoulders because a lot of the time that's what your body wants to do in order to help you. So I'm thinking about bringing the shoulder blades just slightly down onto the back of my ribs so that I don't end up hunching here and kind of looking unnatural. I want to keep the space in my neck really long and just squeeze the shoulder blades together and release. So maybe once you've practiced this and you get the idea of moving the shoulder blade, then we can add in a little bit of resistance. So you might be sitting on a chair, you might be lying down even, you can do this. You can do this with a weight or a resistance band. So I've got my resistance band behind my ribs, and I've got a little bit of stretch here. So again, I'll turn to the side so you can kind of see what I'm doing. So arms out nice and straight, no hunching through the shoulders. And again, I'm just going to push forwards into that resistance and then squeeze the shoulder blades together. So I'm resisting forwards and back. And you could do one arm and then the other arm, just like that. Push and push, or you can do both together. And you can really feel here that you're getting that really nice bit of work in those rhomboid muscles, so the little sideways muscles that come from your spine across to your shoulder blade. Really helps with your upright posture, but it can also really help just to get a little bit of mobilization into that specific area of the thoracic spine, which often feels quite stiff. So that's the mobilization version. What if we use it as a bit of a strengthening exercise? So all we need is to work with gravity, really. So look, you could use your chair and you could lean here. So you've got literally just a little bit of gravity, and then we squeeze the shoulder blades together and part them. Squeeze and apart. And again, it's mobilization, but it's also strength. And then, because it's me, obviously, I think, how do I make this harder? Well, we just add in more gravity. So maybe we come into our all fours position and we squeeze the shoulder blades together and we part them and we squeeze and we part them. And those of you that are really ambitious, we can take the knees back. So we've just got more gravity to work against. Squeeze and lift. Maybe you're in a full plank. Maybe that's a bit much for today. Maybe I'm just showing off. But we're still doing that same movement. We're just adding in more gravity, more resistance, but it starts out as just a stretch, really. And then we can move it on. So you can make it fit you. It doesn't have to be a certain way. So the very last thing that we're going to look at today, because obviously we're moving all the way up the spine, is the jolly old neck. So what do we do when the neck feels really awful? We can't sort of, move around too much. Again, I'm going to do this seated just so you can see, but of course you could do these lying on the floor or standing up, whatever is your preference. So I'm going to make sure that I'm just sitting comfortably. You sit however you're comfortable, or even if you're lying down, of course, that's fine. So when we think about moving the head correctly, a lot of the time, tightness in the muscles is going to try to dictate where we move. So then it might mean that we're not moving the joints of the neck quite as effectively as we can. So sometimes it's nice to practice this in the mirror. Now I've got the camera in front of me, so I can see where I'm going. So I'm going to keep my face forwards. I'm going to keep my chin as if it's on a shelf, and then just turn my head to the side. Really, really simple. But what you'll find is if your neck is really tight, it's going to try and pull your chin down, or it's going to try and twist it up. So it's really important just to check, are we going directly sideways, keeping your chin away from your shoulder, and then to the other way. So keeping that chin away from your chest as we get that true rotation from side to side. And then we can see, is one side much better than the other? Is there a side that we need to work on? Maybe we need to just breathe out and just find a little bit more space on that side if we're struggling with moving evenly. And then we come back to the center. We just do the same thing, but going up and down. And it's perfectly safe to tip your head all the way up. You're not going to do any harm. And then just nod all the way down and feel that nice stretch at the back of the neck. And again, just coming up. And if you were doing this on the floor, you'd just be nodding your head back and forth, keeping the back of the head on the floor. So if I sit up against the wall, you can kind of see what it might be like if I was lying down, just a little lift and then nod down, kind of giving yourself a double chin. So now we're sort of moving the joints behind the nose. So the best thing that we can do to mobilize right at the top of the spine, because obviously your skull sits right on the spine, which the first vertebrae is like behind your nose. So if you imagine that your nose is a pencil, and we're going to draw an infinity sign with your nose. So it's like a sideways figure of 8. And we're going to go up and round. Then look all the way down towards your chest, come through the middle and up and round. And we're getting almost like a sort of osteopathic technique where we're mobilizing through the joints of the neck, safely and carefully, making sure that nothing kind of is pushed to the point that's uncomfortable for you. But it's just a really gentle way of mobilizing those joints for yourself. And just take it nice and slowly so you don't get dizzy. But you can do this as often as you like, as often as you feel like it's useful. Good. So now that we've mobilized the neck, what about our strength? Because of course we've got to balance that up. So how on earth do you get strength into the neck? Well, particularly like for me, I needed to rehab at the back of my neck. I've got a sort of little scar at the back there. So I needed to think about these muscles either side of the neck. Let me turn this way so you can see properly. So another chance to use my little resistance band, or again, you could be lying on the floor with an extra cushion to press your head into. So to isolate the muscles around the neck, we really need to kind of do like almost like a little chicken head movement. So we're jutting the chin forwards and then giving yourself a double chin, lengthening back. So you can do this one to mobilize as well, just like so. Or we can use a bit of resistance. So if I take the band behind the back of my skull here, and I give a little bit of a pull forwards, then it's more effort for me to push the head back and then let the chin jut forwards. So again, I'm keeping my chin level as if it's on a shelf going forwards and back. There's no sort of tipping up and down here. We want to think about chin going forwards and then create a double chin, lengthening the back of the neck. And if you're going into that resistance, then you're going to be strengthening those muscles at the back of the neck, keeping everything mobile so that we don't end up too slouched forwards. Good. So just to round things off for today, because I like to sort of finish with actually something nice, because I've made you do lots of awful things now. So sometimes we get tight at the front here, don't we? Particularly if you're flaring in your ribs. Like I know that's a problem for Zoe, and it's often a problem for me if I get like, you know, a real bad flare and you get that costochondritis, you know, the inflammation of like around the breastbone. So the muscles at the side of the neck attach into the collarbone and into these first ribs. So often a rib flare can then translate up into your neck. So what do we do about that if we need to have a little bit of a stretch of these muscles kind of at the side that feel a bit weird? So I'll come a little bit closer to the camera so you can see my collarbones. Hopefully, if I go like this, you can see my bony bits. So I'm going to find, so this muscle here down the side, it comes down from the bottom of your ear all the way down onto the collarbone and the first rib. So you can kind of see it coming diagonally down, and it often feels a little bit tight. So we can find the end of it just by feeling that end bit of your collarbone here, and then dropping your fingers just down underneath the collarbone into sort of the fleshy part. So what I do here is press my 2 fingers into that fleshy part and then just pull down as if you're switching on a light switch. And then I'm just going to turn my head away from it and lift the chin slightly up. And you might feel this nice stretch kind of down here. And then you can come back. You can find sometimes it's easier if you use a little bit of grip, like your t-shirt. So you press into the fleshy part, pull down, lock the muscle down gently, and then just stretch away. Let's have a go on the other side and just see if it feels similar. So find the end of that collarbone, 2 fingers underneath, press in, switch it down, and turn the chin away. And you might just feel a nice little useful stretch all the way down. So let's just roll those shoulders around, because we've worked the back of the shoulders quite hard. So hopefully you're feeling a little bit taller through your spine, and then keep those shoulders relaxed. Hopefully you're feeling a little bit longer and taller through the neck, and hopefully most of your spine might feel a little bit more comfortable after all of that good work. So I hope I haven't rambled on too long, and that all of that makes sense to you, and you sort of get the feeling that, you know, you can really adapt anything that you want to be doing to suit you. Grab a cushion, grab a blanket, use a stool, use the wall, whatever you want to do. But yeah, if you have any questions at all, just let me know in the comments. We're happy to have a little chat, or if you can't think of anything just now, or if you're doing this on catch up, then write me a little comment, and of course I'll do my best to answer your questions as well. Good, hope you're all feeling all right.
That was fantastic. Thanks so much, Ruth. And yeah, everyone who's trying this out live, please do let us know in the comments how you're feeling afterwards. I was able to join in with that nice little stretch at the end there, and that was lovely. So I'll definitely be incorporating that into my usual stretches. Thank you.
No worries.
We haven't got any questions at the moment, but as Ruth said, please do pop any questions in the comments, and we'll keep an eye on them over the coming days as well, just to catch anyone who's watching on catch up. So thanks again, Ruth. That was fantastic, and right on cue for your furry friend has joined for the end. So that's perfect. Looking very relaxed.
I know, she, you know, is like just quite involved with everything that I'm doing, but you know, I'm sure we all have our kind of weird coping mechanisms as well. I don't know about anyone else that has pets, like they do seem to know when you're kind of not feeling great, and he does often act like a kind of handy little hot water bottle when I need it. But yeah, particularly I know that, you know, obviously in the UK you're sort of going through a bit of a cold snap now as it comes to sort of that normal Christmas season. And it can be that sort of time when, you know, things do get a little bit overwhelming, and you kind of maybe forget about your routine if you've got more things going on. But hopefully some of the things and those little stretches that we've done today that can be done really quite quickly might be something that you can add into sort of, you know, just 5 minutes. I mean, you can stretch your neck whilst you're waiting for the kettle to boil and all those types of things. So hopefully they can just slot into your routine quite easily.
Absolutely. And I love the way you described how some of them in particular you could do in the bed and use the headboard and things like that. So it might be something you can do to kind of loosen up and get started before you get out in the chilly mornings.
Yeah, absolutely. I mean, it can just feel really overwhelming. And, you know, for everybody that sort of goes through chronic issues, I think, you know, it just, we all get those days where we just feel like it's just enough, and we just cannot sort of find the motivation to kind of do what we're supposed to be doing. And particularly, you know, when you have a good routine and you've eaten well and you've got your sleep and you're hydrated and all of those things, and you still get a flare, it can be so frustrating and so demoralizing. So yeah, I mean, hopefully just knowing that it's sort of about just making it fit you on the day. You know, sometimes I will just, you know, sort of be in the studio doing quite an advanced practice on a day that I'm feeling quite good. And there's other days like, you know, all over this weekend, I was literally like blankets and cushions and, you know, everything all around me. So sometimes you can feel like, you know, you've done all the good work and you should be stronger because you've done all of this stuff. But remember that when you're flaring and when you've got a lot of pain, it's very, very tiring. So everything that you do is harder work on your body. So it might look like you're doing something quite simple, but because you might be in pain because you're flaring, like it actually is really hard work. So you're still doing really good work, even when you have to taper things down a little bit. So hopefully, you know, we're all kind of in it together with those words of encouragement.
Oh, definitely are. And it's far better to have the confidence in understanding all those adaptations you can make so that you can keep doing things even when you are flaring and not feeling good. Yeah,
Absolutely.
That's brilliant. Thank you. And we've got a comment from Rachel saying thank you, very helpful. So that's really good. So yeah, anybody else who's watching on catch up, do let us know how you feel after the practice as well. So that's wonderful. So I'll give everyone just another minute in case we have any questions. And while I do that, I'll just let you know about our next session. So our next session is going to be on Thursday next week. So that's the 15th of December. And I'm going to be joined by a panel who wrote the latest British Society of Rheumatology guidance about medications for people with axial SpA when you're trying for a baby, when you're during pregnancy, and when breastfeeding as well. So it should be a really good update on all the latest advice on the medications we can still take safely during those times. So yeah, I'll just check for any other comments and questions. We don't have any more coming through at the moment, but as we said, we'll keep an eye over the next few days and answer anything in the chat there. So if you're watching on catch up, do feel free to pop any questions in there. Any final thoughts, Ruth?
No, I'm just like, hopefully everything's like super clear. And, to those of you that are more sort of experienced with exercise as well, I know this is sort of something that can feel like really frustrating. But remember, just use your gravity in order to make things more difficult. You can always kind of, add things in as well as taking them away. So yeah, enjoy those days where you feel like you've got a little bit more to give, so then you don't feel quite so bad on days that you perhaps need to kind of grade things down again, because it happens to everybody sort of regardless, and there's no perfect formula for everything. So individualizing it is always the way to go, particularly over busy seasons, when you all might be a little bit stressed, or just busy doing everything that you want to be doing. It can really take its toll on the body. So let's stay hydrated and stay moving, and yeah, whatever he said.
Keep stretching by the looks of it. That's brilliant. Thank you so much. What a lovely note to end on. So yeah, thank you, and thank you everyone for watching and joining in, and see you next time. Take care.